Hello viewers, I am Dr. Rahul Reddy from ANDROCARE Andrology Institute, Hyderabad. In this video, we will be discussing about the various modalities of treatment for erectile dysfunction apart from medication. So, if you see the common treatments which are available uh, apart from medical treatment are using a vacuum pump. Second one is medications, injection therapy. Third one is P-shot injections, and fourth one is shockwave therapy. So vacuum pumps are difficult to use. Not everybody can be happy with the vacuum pump. And the penile, same with the penile injections. Penile injections, they are little painful. Every time taking an injection before intercourse is little difficult. So now there are two types of treatments which helps in the long term. So one is P-shot and second one is shockwave therapy. So now when you compare these two, when you compare P-shot with shockwave therapy, so now you have to understand the mechanism of action of these two modalities. First one is P-shot. In P-shot, what we do is we take your blood, venous blood, we separate the platelets and platelet-rich plasma, and we inject into the penis. But so when there were no other modalities, this was very famous. So now, why most of the centers, most of the institutes, they don't prefer P-shot is the results are not permanent. So what happens when you take a P-shot injection? Now when you inject the P-shot injection, see now when you think of P-shot is nothing but PRP injection into the penis. So PRP generally it's available, it's being used by dermatologists for hair loss treatment and other doctors. So there what happens when you inject PRP, it stays there and it works. But what happens when you inject this PRP into the penis is, see penis, the blood flow is constant. So blood is not stagnant, it keeps on moving. Now you can't make this blood PRP once you inject, you can't make this to stay in the penis because it keeps on circulating. So one way is you have to actually put a band or tie to the base of the penis, and then you have to give it to the penis. But actually it causes more harm because when you stop the blood circulation to the penis, it actually affects your vascularity. So now the moment you inject these platelet-rich plasma, immediately it mixes with the blood flow and it goes back into the system. So that is the reason you have to give multiple injections at multiple sites. So one, this is painful, and second one, how long these platelets will take to start its action. Again, it's question of action. It has to be actually it should stay in penis for at least few hours. Then only it helps in new blood vessel formation and formation of relaxation of blood vessels. So now coming to shockwave therapy, other modality, shockwave therapy is more advanced, and there are more studies regarding its efficacy on erectile dysfunction. So now what happens when you do shockwave therapy is, see normally whenever there is a injury or wound or injury to the skin, so now what happens, your body senses that there is an injury, it sends repairing factors to that particular area. The repairing factors, we call them as vascular endothelial growth factors. These repairing factors, they go to that particular site and starts repairing. So now when there is some problem in the penis, now body doesn't know that there is some damage. So now what happens? This shockwave therapy will create an environment which is similar to a wound or external injury. So it actually releases a signal in the penis. Wherever you give this shockwave therapy to the target area will release signals that it needs some repair, and body will send these repairing enzymes to that particular point. So when these repairing enzymes comes there, then they start new blood vessel formation. That is what we want when treating erectile dysfunction. So now this new blood vessel formation will increase vascularity in the penis, and the increased vascularity means more blood flow into the penis. So that is how we get a good grade 4 erection. So now there are different types of shockwave therapies. So now only problem with shockwave therapy is this is not a therapy which can be taken on daily basis. Some previously we tried all those modalities or different protocols where we used to give daily shockwave therapy, weekly shockwave therapy. Now most common way of giving shockwave therapy is a weekly therapy. So now what happens with the shockwave therapy is now, and if you complete all 4 or 6 sessions, then only it helps in angiogenesis. Now if you, after taking 2-3 sessions, if you stop, then the signal system will slow down and you won't get the actual benefit from shockwave therapy. So this is the only disadvantage with shockwave therapy. If you have to take, it's better to complete all 4 in a go. The ideal gap between each session should be 5 to 8 days. It should not be less than 5 days, or it should not be more than 8 days. So for ideal enzyme release, this is the ideal protocol. So we tried giving 2 sessions in a week, 3 sessions in a week, but they won't work. So ideally you have to wait for at least weekly once you have to take a session. So now if you compare with PRP and shockwave therapy, if you take PRP, the results are clearly short term. You may see improvement for 3 months, 4 months, 5 months, and again the improvement whatever you get with the PRP will slow down, and again you face erectile dysfunction. That is the reason they say PRP has to be regularly repeated. But shockwave therapy, once a new blood vessel forms, generally it works for 3 to 5 years. For diabetics, hypertensives, it works for 3 years. For normal people, if they control all the other lifestyle, basically if they change their lifestyle, it works for 5 to 6 years. And the shockwave therapy is really painless. No side effects, no reported side effects till now. But what has been, what we have been noticed is now there's so many unqualified doctors giving shockwave therapy on daily basis, daily twice, and using unqualified machines or unrecognized machines. That is a disturbing factor in this field. Now why we say is there are only few companies like Direx, Piezowave, Stoge, Richard Wolf and Donier, and there are few companies which are actually did lot of research and produced these machines. But now if you see, there are so many Chinese companies which are producing shockwave therapy machines, but which are not validated yet, and nobody knows what is inside. So you have to, whenever you are taking shockwave therapy, you have to inquire about the brand or company which produce that shockwave therapy machine. So otherwise there is chance that you may get cheated. Be careful. So okay viewers, if you have any other doubts regarding this, please post it in comment section. We will try to answer those comments. Thank you.